Hello and welcome to Relationship Resolutions. My name is Calvin Smith. I'm a licensed clinical professional counselor, a family and divorce mediator, and an ordained Christian counselor. Today I'm going to talk to you about how therapy can benefit your relationship. A lot of people have questions about how therapy can benefit their relationship. So when most people come into a counseling setting, they come looking for hope, direction, or relief. Hope meaning they're looking for options, things that they haven't thought about, things that they haven't considered, and then from that information, getting direction, and which can point them in a way to solve or resolve their problems, their challenges, and then also relief. Something is on them so heavy, and they really want to get from underneath the pressure of whatever it is that they're experiencing. The good news is that the therapeutic process is designed to provide all of those things. It is designed to give hope. It is designed to provide you, to make you more informed, which gives you more choices. It empowers you to have more direction in your life, and consequently, it also gives you relief. There are other aspects of things that can hinder and affect a relationship. These things can be financial, they can be physical, they can be environmental, they can be occupational. There could be familial. There are just many different dimensions through which a couple experiences certain stressors, and based upon those stressors, certain interventions are imposed or applied versus just oh, hang in there, swing it, we'll get through this in the great by and by. No, there's more to a therapeutic intervention than that. Um, Different counselors have different ways of going about solving these kinds of challenges, but but you are the judge, you are the assessor to actually assess whether these interventions are working in your life, in your relationship, or not. So it's important for you to not hand over your assessment to anyone else. You have to be able to actively work with the therapist to determine and assess whether this is adding value and is meeting your goals or not. What can you expect when you when you walk into my office and you're asking for help with your relationship? Well, one of the things I'm going to do is I'm going to ask you first to sit down, and I'm going to explain to you a little bit about the therapeutic process and my background and all of the training that I have, and then what you can expect from therapy, the pros and the cons, and then I'll also go through the your rights, so you have an understanding of what it is that you have the right to in therapy. It's not just a casual conversation. It's something that's geared towards really helping you to walk into this process empowered. After that, you'll sign some documents. The documents are just allowing you to acknowledging that you have requested for me to provide the services to you that you're seeking. After that, one of the things that we'll begin to embark on is exploration of your relationship. Exploring why and what your history is, your personal history is, and what your conflicts are, what your commitments are, what your intentions are, levels of communication, your conflicts, what you're striving for. I mean, there's a lot of different things that and dimensions that go into assessing your relationship. After we assess your relationship on that level, then what I'll do is I will make a prognosis or I'll give a recommendation. Usually, what I like to do is I like to set it for maybe 3 to 6 sessions, just to kind of see where we are after we set the goals, so that you can um, uh, evaluate your level of progress. So how do you know if progress has been made or not? Usually that progress is identified through being able to assess whether the behaviors have increased or decreased over that period of time. If it's gotten more volatile, then you know that there has been little improvement by the intervention. But if there is more improvement that is marked by the interventions that I use, that are recommended and suggested, then at that point, you'll be able to assess whether or not you want to continue the process or not. Now, if I feel that the uh, sessions are not progressing, they're not moving the way that they should be moving, what I'll do is I'll cancel. I'll cancel, or I'll refer you to another clinician that I think may be suited for your particular need. But if the services warrant further continuation because some measure of progress has been made, but we haven't quite gotten to the goals that have been set for the session, the therapy process, then at that point, what we'll do is we'll continue with discretion on that platform. I hope that this educates you a little bit on the process. Going to counseling is a big step for some, and it's pretty casual and maintenance for others. It just depends on how familiar you are with the process and what you know to expect from it. Thank you for joining me today for our message on how therapy can help your relationship. If you're desiring hope, guidance, direction, or even some relief from some of the challenges and struggles that you may be experiencing, then perhaps setting an appointment may be a good place to start. Give me a call or email me at calvins@awibehavioralhealth.com, or visit my website www.awibehavioralhealth.com for more information. I also have memberships and plans that you can register for. It adds to supportive material that will enhance and feed your mind, feed you with creative ideas about your relationship. Listen, I want to see you healthy. I want to see you happy. I want you to have the best relationship yet. Thanks for joining me. I look forward to seeing you next time.